Hi everyone, welcome to this third day session for the head neck MCQs. I'm Dr. Ankit and we have these two MCQs. Let's start the first MCQ over here. A 45-year-old man was seen in the emergency department, after being knocked down in a street brawl. He had received a blow on the head with an empty bottle. On examination, the patient was conscious and had a large swelling over the back of the head that was restricted to the area of the occipital bone. Very important point. So there was swelling that was restricted to the occipital bone only. The skin was intact and the swelling fluctuated on palpation. The following statements concerning this patient are correct except which? Let's see the options over here. The hematoma, although large, did not extend forward to the orbital margins and did not extend laterally as far as the temporal lines. So that is a correct statement. We have to identify the wrong one. The hematoma was located just beneath the epineurossus and was superficial to the periosteum of the occipital bone. And second option, they are saying it was just beneath the epineurossus and was superficial to the periosteum. Now, in this case, if it is subepineuritic bleed, right, then it won't be restricted to the particular bone, right? Therefore, option number B looks like the correct answer. Let us see other options. The hematoma is restricted to one skull bone and is situated beneath the periosteum. That is the correct statement. It has to be limited. The hematoma is limited to one bone, so the bleeding has to be deep to the periosteum. Option number D, the edge of the swelling is limited by the attachments of the periosteum to the sutural ligaments. That's the reason. D is the reason for C. Now, let me tell you a couple of things over here. Let me just zoom it a bit. See what happens is we have the layers of the scalp, right? We have the skin, then we have the connective tissue layer, then we have an aponeurotic layer, then we have a loose areolar, and finally we have the periosteum. Now this periosteum, suppose this green line I'm trying to show is the periosteum. This periosteum actually is fused to the bone, right? These are the bones. Which bones? Skull bones, and the periosteal ligaments are fused over here to the sutural ligaments. Understand this point. I'm writing again. This is the outermost skin part. Then you have the connective tissue. Then you have the aponeurotic. Then you have the loose areola, the dangerous layer. This is the periosteum. Now this periosteum is fused to the sutural ligaments. Now see what will happen is that if the bleeding is just beneath the aponeurotic layer over here, anywhere over here, it won't be limited to a bone. It causes or leads to black eye. While on the other hand, if the bleeding is deep to the periosteum, then how much amount of bleeding is, it will be restricted to the bone only. And that was the case that in this particular question, that the bleeding over here was restricted to a particular bone. Therefore, option number C is correct, but D is wrong, and we have to identify the wrong one. Therefore, we would go with option number B over here. Option number B will be our answer. That's the wrong statement. Have a look at this. These are two particular cases over here. Suppose we label it as figure number A, figure number B. In figure number A, the swelling in this particular child is restricted to one bone only, mainly on the left parietal, we can call it as. So it is restricted. Option number B, you can see it is spreading out throughout the skull, right? So these are the different things, and here in gynae we call it as cephalhematoma if it is restricted to a bone, and caput succedaneum if it is spreading around. So remember these two differences in swelling of the scalp. And if the bleeding is deep to the aponeurotic and if it is spreading all around, it leads to a black eye image like this, right? Fair enough. Let's see the next one. And an unconscious patient is admitted after sustaining a head injury. The physician performs an ophthalmoscopic examination and finds that the pupil of the left eye constricts when the light is shown to that eye. Fine, that's a good thing. The question is, pupillary constriction on stimulation by light indicates which two cranial nerves? So they are basically asking us that you see a light reflex. What is this? This is a light reflex, and it involves which two cranial nerves? Now, in any reflex, we all know that there is an afferent nerve, there is an efferent nerve. Now, if you show a light to the eye, right, that light it stimulates the retina, and that light is taken up back into the brain by which cranial nerve? It is the optic nerve. It is the optic nerve is the one which is seeing everything. Now then, after processing in the brain, particularly in the midbrain, we have the Edinger-Westphal and the pretectal nuclei. Then the efferent comes to both the eyes, and then you have the pupillary constriction. The pupillary constriction is done by which muscle? We have the sphincter pupillae. Now this is innervated by which nerve? The nerve over here is the third or the oculomotor nerve. Okay, so the afferent is the optic and the efferent is the oculomotor. Optic is the second cranial nerve. Now we know the basics. Let's simply jump to the answers. Second and third, optic and oculomotor, will be our best possible answer over here. That's all. I hope you're enjoying. Thank you.